The Injured Senior Podcast is here to help. Like it or not, the senior and elderly population is vulnerable to negligence committed by medical professionals, nursing homes, assisted living facilities, pharmaceutical and medical device companies, insurance companies, and everyday individuals and businesses. Your host, Steve Heisler, creator of the National Injured Senior Law Center, has been advocating for seniors' rights for over 30 years and is bringing you answers to your questions. This is the Injured Senior Podcast.
So we are talking to Dr. Dr Stout, Legionnaires Disease expert, infectious disease microbiologist, and president of Special Pathogens Laboratory. Now, Dr. Stout, are seniors more at risk of getting Legionnaires disease?
That's a great question, and one that I'm sure your listeners their ears are perked. And the short answer to that is yes. And so as we've studied Legionnaires disease over the years, there are certain groups of people that are more likely to get the disease, meaning where lots of us are exposed to Legionella bacteria in water, but who actually gets sick? So the typical factors that make it more likely are you a smoker? Do you have chronic lung disease, COPD? Are you receiving steroids? Do you have any immunocompromising conditions, like are you receiving chemotherapy for cancer? Are you a transplant patient? But one of the most significant risk factors that has been noted, since the beginning is advanced age. And I sort of make a joke about this when I lecture. The CDC says anyone older than, drum roll, 50 years old is at greater risk. Yes, I know. So we're all elderly, we're all together. But basically the risk gets greater as you age.
Okay. And there's nothing we can do about that. So we all need to be on our P's and Q's if we get pneumonia. I'm 59, so I'm in that category. Dr. Stout, do seniors need to worry about getting Legionnaires disease? Are they coming into situations where they could be more at risk than others? I mean, considering their advanced age, but as far as being in certain areas or places, where are hotbeds that they need to be aware of?
I hope that most of your seniors are enjoying a wonderful retirement. And part of retirement often involves travel, for example. And there's actually a category of travel-associated Legionnaires disease, and that's connected to the fact that hotels are a place where we can be exposed to Legionella bacteria, and because of our advanced age, we can go on to develop Legionnaires disease pneumonia. And the places in a hotel is the warm water system, the faucets and showers, that beautiful decorative water feature in the lobby. You're sort of tempted to hang out by the bar, by the decorative water feature, and they have been linked to cases of Legionnaires disease. And then finally, that spa or hot tub that feels so good to be in it, but again, cases of Legionnaires disease have been linked to that. And then the other thing that I worry about for seniors is because they're at greater risk, no matter where they go, whether it's at the hospital, they're at greater risk if that hospital has got Legionella in their warm water system, whether they travel, or even in their own homes. We showed that senior folks were at greater risk even from exposure to Legionella bacteria in their own homes. So the simple answer is that there's greater risk. You want to be vigilant and make sure that the physician tests you if you have pneumonia, tests you for Legionnaires disease, because treatment is very effective if started early. Okay,
thanks for that. Well, you mentioned and you talked about that hospitals are one of the, I don't know if you said breeding grounds, but I believe from what I've read in my experience as a Legionnaires disease attorney that hospitals are a breeding ground. So the Center for Medicare and Medicaid issued a requirement for hospitals to assess whether Legionella is a problem. What became of that?
Well, I love and hate telling this story, and your listeners will appreciate this. So prior to 2017, there was guidance and some standards that were voluntary that said, you really should be assessing risk in large buildings like hospitals. Well, then, out of the blue, in 2017, the Center for Medicare and Medicaid Services issued a memorandum that said not only should all hospitals, healthcare facilities, skilled nursing facilities assess the risk, have a water management plan, but also test the water, which is something that we have been advocating since the 1980s. And so you can just imagine, I was doing my happy dance. I was like, finally, the requirement to test hospitals has arrived, and that's going to save a lot of lives. And I was happy for 1 year, Steve. And what happened in 2018 is a revision from CMS in that memorandum, and they removed the requirement for testing for Legionella, and I got really upset.
Do you have any idea why that happened?
Nobody has spoken about it, but I can assure you that CMS was lobbied heavily by organizations like the American Hospital Association to remove it. And we could spend a whole show just sort of talking about the history of this and why that would happen. This is why I say that seniors are the canary in the coal mine for Legionnaires disease in hospitals, because there's no requirement now to test those hospitals for the presence of Legionella. The people in the hospital, like these seniors that are listening, are the ones that are going to get the disease, and then they will hopefully make the diagnosis and then address the problem. But we want people in hospitals to be more proactive. We don't want people to get sick to be the indicator there's a problem. We want to know by testing the water that there's a problem before people get sick, because we push sort of a proactive approach called test to protect, which is find out if Legionella is present. Only about 50% of the large buildings like hospitals have Legionella in it. So you want to know, is your hospital the 50% that have it, or is your hospital or nursing home the 50% that don't? And so I really want to ask your listeners to help me advocate for a change in CMS's position. And I'll just tell you my goal, Steve. My goal is to write a piece in AARP about this and sort of send the alarm out to all seniors that this is something that they can actually advocate for with CMS.
So, Janet, what you're saying is that obviously seniors are going to probably have a hospital stay somewhere in their immediate future or not so foreseeable future. So what they can do is they need to kind of notify Congress or notify their congressmen or senators. Are you saying that they should actually be notifying their politicians?
I've been in this for more than 30 years, and I've been waiting for regulatory agencies like CMS and others, CDC, to be more aggressive at protecting seniors and hospitalized patients from the risk of Legionnaires disease. And at this point in time, after what happened with the CMS memorandum, I really believe it needs to be a grassroots effort. So I would say yes, anyone listening that is concerned about this, and you should be, contact your politicians, but also maybe even just submit a comment to AARP that says, hey, this is an important issue. Dr. Janet Stout needs to let all of us know about the risks and how we can protect ourselves and what hospitals should be doing to protect their inpatients.
Great. AARP is a very, very strong lobbying organization, so I think that's some good advice. Other than that, what can seniors who are in the hospital do, if anything, about reducing their risk of contracting Legionnaires?
Well, at the present time, if, for example, if they were in a facility, whether it's a skilled nursing facility, a rehab facility, or an acute care hospital that has Legionella in its water, they wouldn't know. So you can ask, are you testing for Legionella? Or, this is what typically happens. If you would have symptoms, respiratory symptoms, and then be diagnosed with pneumonia, even after you leave the hospital, because the incubation period, the time from exposure to symptoms can be as long as 10 days, make sure that when you speak to your physician that you're tested for Legionnaires disease and you're given the antibiotic that's effective against Legionella right away. So that's what you need to do.
That's good advice. Thank you, Dr. Stout, for that information. How can our injured senior and aging population community find you on social media?
Well, they can follow Special Pathogens with an S Laboratory. So we're on social media. And again, they can reach out to me personally at info@specialpathogens with an S lab.com.
That's great. And of course, can you give the website address again?
Sure. It's, www.specialpathogens, pathogens lab.com, specialpathogenslab.com. And lots and lots of good information on our website that's very useful. And we also have another informational website, legionella.org. And you can read stories there of people who have suffered from Legionnaires disease and get other frequently asked questions there. So both websites have a wealth of information for your listeners.
Thanks again, Dr. Stout. We will definitely want to have you back because there's so many other things that we can talk about that would be of great value to our listeners. So take care now, and we will be talking to you soon.
Thank you so much for having me, Steve.
Injured senior and aging population community, thanks for listening to today's episode. It was a good one. I want to, again, thank Dr. Stout for appearing on the show today and just giving us so many nuggets that we can use to avoid having a situation that can come from Legionella bacteria. If you love the Injured Senior podcast, we would love for you to subscribe, rate, and give a review on iTunes. If you want to share your story on an upcoming show, maybe about Legionnaires disease that you contracted, or have any other suggestions or comments about the show, please email me at steve@injuredseniorhotline.com. As you know, I answer all emails. So until next time, I am looking forward to next week's show. Stay well, stay safe, and I'll see you then. Take care, everybody.
Thanks for listening to the Injured Senior Podcast. If you enjoyed the podcast, please rate, subscribe, review, and share on Apple, Google, or wherever you get your podcasts. Connect with us at injuredseniorpodcast.com and sign up for our newsletter. To find out more or to get help at any time, visit injuredseniorpodcast.com or call 855-622-6530. That's 855-622-6530.